Hello, everyone. Max Cisneros here, the Latinx Program Officer for the New Haven Pride Center in the city of New Haven for the state of Connecticut. And we are here today asking one simple question: why is the face of HIV/AIDS black and or brown? And so we put together a panel to answer this question and explore the issues around this. And this is in observation of World AIDS Day, which was yesterday. And yesterday night, New Haven Pride Center had the premiere of pretty much the crown jewel of these programs that we're putting together this week called Night Sweats. I would urge you to check that out. We'll provide the link in the comment sections on YouTube and on Facebook. Anyway, welcome and thank you for being with us here today. We have an awesome set of panelists to be able to talk about this issue. And first, I just wanted to observe that this is not just a World AIDS Day observation event connected with a series of panels and events that we have going on this week. Tomorrow is the last day. But if you have any more questions or want more information on our website at newhavenpridecenter.org, there is a roster and a list of panelists and times and links that you'll be able to find and just kind of like lose yourself in information as far as what we can be able to provide in programming and events going on this week. So without further ado, I want to introduce the panelists. And so first, I want to introduce Keith Taylor. Keith Taylor is a stay well. Here he is. There he is. I see a little wheel turning. There we go. Hey, Keith. Good to see your smiling face. Keith Taylor is working in the HIV/AIDS field for over 18 years. He has tested over hundreds of people from Orlando to Montgomery to Nashville to Danbury and Waterbury, and pretty much all over Connecticut. And as a openly identifying person living with HIV/AIDS, like myself, Keith focuses on self-empowerment, disclosures of status, medication adherence, and raising awareness about PrEP, harm reduction, and SSP programs. And we'll talk a little bit more of that because I'm curious to know more about that. But I appreciate you being here with us, Keith. I also wanted to ask a little bit more later on about many men, many voices. That seemed really interesting to me the more I was reading about it. But to finish up, healthy relationships, community promise, and other works that you've done. It really fascinated me, and that's a lot of the reason why I thought that you'd be an awesome voice to have on this panel. And so, yep. And I wanted to basically, well, before let's go on with introductions, I'm already ready to start asking questions. Okay, and our next panelist is Latrell Floyd, and we are very pleased and happy to have Latrell here. We gave Latrell no room to breathe because Latrell just got tapped on to be prevention services coordinator. I believe that's the title over at APNH, a place to nourish your health here in New Haven. And so having a voice, a local voice here in New Haven, speaking, about these issues, to me, it's just it's basically an honor having you here. Thank you for being with us, Latrell. Latrell, like I said, is working at AIDS Project New Haven, our place to nourish your health. With his social work background, he has worked with various populations, including children and families, the elderly, those with mental health, and those affected and affected by AIDS, HIV. He is an alumni SCSU, class of 2019, and Fordham University. So I just really appreciate you being with us. Louis will come in. Just think like the Kool-Aid man. He's just going to burst in here at any point, and then we'll just accommodate him into the conversation. But first of all, what I wanted to do, if y'all can join me in a moment of silence, because you know what, I feel like, this is an ongoing situation. Pandemics seem to be a topic right now, but this is a pandemic on top of a pandemic on top of a pandemic on top of another one. And so I feel like saying a moment of silence for all those that we have lost, not just this year due to COVID-19, but really the 40 million plus that have died since the beginning of this outbreak. So if you can join me a moment of silence, and then we get right into the info. Whew. All right, thank you so much. I appreciate you. So let's start off with the basic question. We're going to be a bit thematic over here. Let's start with the basic question. Do you believe, because many people may not necessarily agree, I walked into this thinking that this was something that was generally known, but some folks may not necessarily agree that the face of HIV/AIDS is black and brown. So let me ask you, do you believe that the face of HIV/AIDS is black or brown? And why or why not? We'll start with you, Keith.
And yes, I do. And there's many reasons. Most of it's because of the lack of trust in the healthcare field, as well as willful not wanting to learn as well. Because now we're at an age, I look
Mm,
back and I see that a lot of people just don't want to know because they just don't want to know as well.
yeah, I think that's something that does happen. And we'll talk
Yeah,
more about that. The ignorance in itself has a huge effect apart from everything else.
exactly.
Latrell?
Yep, like Keith was saying, I think there's a huge lack of education in terms of the black and brown community regarding HIV. Like Keith was saying, people just don't want to know. Just speaking like personally, many days and many conversations I've had with people that I know, just educating them on like you equals you and like you can't pass it through sex and things like that. So there's just a really big education, like a lack of education component in terms of that. And it goes beyond just basic education. It's higher education as well. Being in school, I did not learn, to be honest, I did not learn anything regarding HIV and AIDS. If it was touched upon, it was just like little points, but there was no conversations about you equals you. As a gay man myself, um, I personally didn't know what prep or anything was until I actually started having sex with men. So there is a big disconnect
Mm,
there. And also, besides that disconnect, there's the disparities that Black and Brown people face is like also another huge indicator in terms of why Black and Brown people are so have higher rates of HIV and AIDS.
Yeah. I
yeah,
also
that's
think that
something
we
that.
don't have our
Go ahead, please, Keith.
priorities in mind.
Mhm.
You know,
Say that again. We don't
we have
have.
our priorities in line when it comes to our 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 colored people or brown and
No, I
Mhm.
got you. Our flavors.
right, our brown and black
I
folks.
think that's
Okay,
right.
I'm serious
Yeah, I think that's
because
right. I would ask you which of the priorities that you're thinking that we're getting right, or which of the ones that you think we're getting wrong.
well, as far as health wise, you know, we'll work on the outside of our bodies quicker than we will the inside of our body. You know, I see a lot of pride in black and brown people that causes them to make a lot of decisions that are not good for them because they are trying to look better than the Joneses, I guess you want to call it. It's
Mm,
not just our cultures, it's just that I'm just calling it out as what I see in our culture. Um, and I think it's time for us to stop doing that. I think it's time that someone needs to be the one that says, look, this is the better way to live. Trust a doctor. You know, praying all the time is not always going to get you through everything. We have to sometimes endure those things. You know what I mean? I mean,
mm,
that's what God is. He'll get us through it. Doesn't mean that he's got to take it away all the time. I think a lot of times we don't want the fight. You know, we just want the the finish. You know, tell me what it is and I'm done. You know what I mean? We don't want to fight through it. Because I had to learn that for myself, you know, being HIV positive in the beginning, because I was praying it away. You know what I mean? I was quoting the scriptures that I was taught. I was doing all of that, you know what I mean? Praying it away. But it was still there. So then I began to realize,
yeah.
okay, so you're gonna take me through this, God. Okay. So then that's when I begin to reach out to other people. You know, okay, he's not gonna take it from us, so stop praying that. Let's just go through it together, you know, because he can take us through it.
And
And that's a really
Keith, I do.
powerful point. Particularly, please go ahead. I'm listening to
You
her.
know, I was just gonna
Go ahead.
shout out Keith. And there was something said that the fear of contracting HIV at the time felt almost as if you were being punished for being gay. Um,
Yes.
that like resonated with me because I feel like that's still happening to this day. Um,
Yes.
so I definitely just want to shout out that particular saying. I just loved it, and I think it's still happening in today's society. It's almost as seen as like a gay disease in a sense
Yeah.
that only gay people or people in the LGBTQ plus community can get it, and that's absolutely not true.
That's
And
not
this
true.
goes back, and this goes back to the education aspect of things. There's many people that have gotten it through injection use and blood transfusions and anything like so.
Right. Right. And they always are quick to correlate it with a sexual thing. And remember, we were also taught, to hide our bodies and don't touch that until you're married, and you know what I mean. So all those things are embedded in our mind, whether it be straight or gay. You know what I mean? Whether it has nothing to do with who
Mhm,
you choose to be with at that moment. It's the fact that what we're taught, we continue to bring it into our everyday lives.
mhm.
And a lot of the things we were taught, we need to unteach ourselves. And that's
Agreed.
where I believe the Black and Brown community well, actually, this year has been an eye opener for the Black and Brown community for me to see. And I feel that this year should be the beginning of a new era when it comes to this fight with the HIV epidemic,
Y'all are making my hand get carpal tunnel because I'm trying to keep up with all that y'all are covering, and I want to unpackage what you're saying here because it's impactful. This is what I meant about having this conversation because I felt like it's really necessary. But let me just make two quick points just to add to what you're saying, but also ask you from it because there are a lot of similarities between the Black and Brown communities, and
Yeah.
not just that. We can even
Yes.
take that further into like the BIPOC communities. But one similarity I just wanted to make is a sense of spirituality. The ignorance isn't
Yeah.
all that different for each other because we're very spiritual folk. Black and brown
Yes.
folk, we hold religion in very high regard. And that's something that's really similar among us, but it also hinders us because
Yes.
a lot of us don't have the same kind of like need to go see the doctor. And if we do, first let's take this tea, first let's see about this herbal, let's first. And there's reason for that. I want to create a space for that because whether it's Tuskegee, whether it's different
Right.
experiments that's been done in Black and brown communities by professional health public experts, professionals, like there is a suspicion that exists,
Right.
and that needs to be. And I feel like part of. I'm going to ask you this actually. So, what do you feel like is a good way to be able to focus on convincing or making a case to Black and brown communities that yes, these things happened in the past. These they did happen, and you have full. You're valid. It's valid to have these suspicions. However, now we know that there are Black and brown people that work in these fields that have best interests of folks who look like us
Right.
at heart. What's the best case that you could make to these folk and let them understand that go see your doctor? You have suspicions, but also be armed with the knowledge that you know what's best. They're working with you.
Right.
Something, some message like that.
Go ahead,
Keith?
Lisha.
I
I was
would
gonna let
just,
him go.
I would just say honestly, I mean, I would just say get down and dirty, essentially. Like Keith was saying, like people
Mm.
are more inclined to get their outside of their body done before the inside. Go, and it's just this is where outreach comes into place. Going on the streets, you can buy all these Jordans, but you can't take your PrEP pills or
Yes.
like things like that. Like we really have to like really, really, really like go on the streets, outreach, educate the community, and that's one thing I can say. Like
Yeah.
there's no reason why people are getting their hair done all these different times, getting their nails done, Jordans, getting and if we're looking on like a more global level, these celebrities getting like all these like procedures done, but yet not taking their PrEP pills, not doing this, not doing that, not doing that. Um, and
That is so true. I, for me, I like to just call them
That's
on
a good
on
point.
it.
Yeah.
You know, it is time now to get your together because
yeah,
you'll
okay.
save that money and you'll do all that to go to the clubs. But as soon as somebody says something about, well, about HIV, you're gonna run and hide.
Mhm.
Stop it. It's time to step up and prep it up. You know.
Love it. Mhm.
it is.
Mm,
It's time to stop putting all that.
I'm gonna use
Every
that.
time somebody, like for instance, in Waterbury, we've been going to a lot of the barbershops and the salons to give out condoms during this pandemic. And when I was in Alabama educating, there was some salons that I was able to go in and educate while they were getting their hair done. And I asked them questions and things like that. And it was such a fun atmosphere. And they really enjoyed having that conversation while they were getting their hair done. But we need the owners of these salons and these barbershops to allow it to happen.
Mm,
You know, if they get behind us and say, yes, please come in here on a Saturday when I'm busy and throw out some questions and some gifts and make it fun for the whole atmosphere. There's no excuse if you have somebody of the same color coming into your agent to your company and saying, look, I'm here to help, and you turn them away. That's the most frustrating thing that I've ran into is that
Mm.
here I am. I'm not worried about straight, gay, black, blue, purple, or green. You know what I mean? I'm here about your life. And that's what it's really all about. You know, that's what we're here for. We're
Mm.
here to educate you and help you have a better life, not just on the outside, but on the inside too.
we really just have to start breaking
I
down
think
these
that's what's really
taboo
powerful,
topics.
actually. I think that like being mm, really and make them less taboo, make it easier to talk about. Like the example
Yeah,
y'all are making about education is so phenomenal because I think that I think that part of being invited into this history is so important because you feel like you're part of the struggle, and so you feel like you want to take part in it. I'm gonna take my pill today, and I'm gonna remember to take my pill because folks got arrested, folks died, folks worked and really hard in being able to get me to have that pill for me to take. If
exactly.
you feel invited to this history, you'll feel more a part of the struggle. One example I wanted
Mhm.
to use real quick is that there's a young man in 1968 that was admitted into the same I think it was St. Missouri, St. Louis Hospital, right? And it was a 15-year-old youth, black
Mhm.
and MSM most likely, and he had pneumonia, is what is the doctors could describe. And 1968 was the first young man died a year later. Died a month before the Stonewall riots. Just to put that into context, that young man was the first known instance of
Mhm.
somebody dying of HIV.
Mm.
And that was reported by the CDC. And I only really found out in 1985. And in 1984, interesting enough, I think around that time, there was a doctor named Michael Gottlieb who wrote a report where seven folks were part of the study, but he only mentioned five because they were a heterosexual Haitian and Hispanic homosexual were not included in the report. And when Michael Gottlieb was asked, why didn't you include the other folks in the report in 2017? His response was, and I quote, because I didn't think it mattered. So when we think about the face of HIV/AIDS, when we think about this, why is it that nobody knows Robert Redford's name, but we all
Right.
know Ryan White's name, a
Hmm.
young man who died in Kokomo due to a blood transfusion? A really, for the
Yeah.
most part, innocuous way of, transmitting it. But if we think about why is the face of HIV/AIDS the way that we feel now, but we're looking at these two scenarios, two youths that died of the same ailment, but we really only know one name. So what I'm going to ask you is, today, considering what's happening today, pandemic on top of pandemic on top of pandemic, all it really shows us is that the same communities that always end up getting the wrong end of the stick always seem to suffer the most. Do you believe this has more to do with the behavior of the individuals, or with possibly we could say health disparities within these public health systems and service providing systems? I'll ask you,
Yeah,
Ashwell,
of
first.
course.
Yes, I certainly agree. Typically, black and brown individuals that, let's just say, if they're coming from like a low socioeconomic status, they're not going to get the best care compared to someone that it comes from more wealth and is essentially white skinned. Therefore, their lack of care is not going to be substantial enough for if they were to attract like HIV or AIDS or anything like that. Um, yeah. So it really just comes down to
Okay.
like your socioeconomic status and the amount of the doctors that you essentially go to. Um, Most likely, if you are in like a more of a lower income area, there may not be doctors that are equipped to prescribe PrEP or may not even know even what it is. So that's also like really important to consider.
Yeah, I agree with you.
In Connecticut, I think it was pretty much reported. It, go ahead, Keith. I'm listening, Keith.
I just heard my dog barking. Of course.
That's what that
um,
was.
yeah, yeah. I'm actually going to have to let him out of the crate. Somebody just left the house, and I told him to come
One
in the
point I
crate.
wanted to.
Go ahead.
Okay, no worries, you're good to go, love.
Yeah,
But
I'll
one
be right
point I
back.
wanted to make also is that it seems like you're love, no worries. I wanted to make sure to be, aware that whenever Lewis pops in, so that's why I'm kind of like pausing every 2 seconds. But one point I wanted to make also is regardless of where you're looking, the size of the data set that you're looking at, the size of the city, size of the country, you almost see the same thing happen over and over again. Usually the black population ends up being around somewhere around 10 to 13% of the population. But they end up being almost half, 45% of the deaths end up being black and brown communities, particularly black communities. The proportion higher there. So clearly, what we're seeing is there's nothing special about black and brown bodies, right? There's no specific reason why they would be suffering in these numbers, other than that there's a systematic situation going on where folks, and here's going back, I'm just going to push back a little bit on what Keith said earlier, because just to provide a little context of the kind of situations people are dealing with here, there are certain situations where folks got to make paper, got to make money. And if the way that you make money is you put up a website, fans only channel, or an Instagram
Mhm.
post here and there, where you promote your fans only channel, and you're looking a certain way and you're feeling a certain way. Our looks have power, right? Our looks have
Mhm.
power, and so when people decide to invest in the way that they look on the exterior, they're investing in a certain power. However, they're not putting in priorities, what you said earlier, Keith, if I'm understanding you right, they're not putting in priorities the internal power, the power of your own health. And that has a significant place for a lot of folks to be able to understand. So my question would be why it feels as though that it's a bigger impact to invest on your exterior than it is to really invest the time, the energy, the effort into your own health and your own well-being, right? And that could be mental, that could be physical, that can cover a lot of ground. So my question is, why does it seem like it's easier? Is it because it's a quick buck? I'm asking you, why does it seem like it's easier to invest in the way that we look than our own health a lot of time?
Well, to
I'll ask.
me,
Go ahead. However, we'll
okay,
popcorn it.
okay, to me, it was. I see it as the way we were taught, and it starts within the church. We were taught to trust God. God is going to get us through a lot of this, our life. Um, but we lost the aspect of through that trust in Him, we still have our own free will, and we have our own free desire to do things too. So basically, what I'm saying is that we have to do stuff as well, not sit back and allow Him to just direct or just have life that's like this. You know what I mean? We have to do things, and that includes taking care of your temple. Taking care of this body that we have. It's so easy. Yes, it's easier to work on the outside because it's what we see. You know what I mean? But we can't get to that pain that you caused 18 years ago. You know what I mean? If I can just get in there and get to that pain and fix it, then I'll be able to fix some other things in my life. So our priorities have to get to the point where I know that I have faith in God, but it's not everything. You know what I mean? Because there's a free will within that. It's 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 like I talk like that because I come from a preacher's child. Okay, my dad. So I was raised in that era, and I know how Black and brown people love God, and not to say no other cultures don't either. I'm just saying that I'm just talking about ours because we know ours, and we can talk about that. Um, we there's just a different way of how we see him. You know what I mean? And and it also goes back to the roots or in the era of the slaves and all that is brought into our everyday lives, and it's so hard for us to break those chains that they created, that as we got older in life, like our grandparents, there's so many stuff that our parents and our grandparents say today. We're looking at them like, y'all lost your mind, you know like there's one thing: I am not my ancestors, don't step to me. I saw that. I mean, there's a lot of things like that in this day and age. We have to unteach ourselves so that we can get the right knowledge in there. And that includes that God is not always going to be the protector of this body, then keep me from catching anything if I don't protect it as well. You know what I mean? It's a two back and forth thing. It's not just waiting for him to decide, well, I'm going to take this diabetes away from you today. No, in the meantime, take your pills. Watch what you're eating. There's things you have to do, but it's easier to see the outside and lift weights and look all good, but yet you got high blood pressure. You know what I mean?
But then, at the same time, Keith, like I really like in my mind, like as you're talking, I'm like culture, 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 because
Yeah.
like being raised in a Black household myself, and I was raised by my grandmother.
Mm-hmm.
It was certain things aren't seen as that serious, and I think
Right.
HIV and mental health essentially is one of them as well. Like my grandmother or other Black families would be like, oh, like if you have a headache, oh, it's not that serious.
Mm-hmm.
Or for example, like if I had like some stomach pain, it's go take some Pepto Bismol. It's not like let's go to the doctor. So then
Right.
that's where it goes culture, culture, culture. Me being raised by
Yeah.
my grandmother, she's like an older figure.
Mm-hmm.
So, back in her time, that was just the norm. So I like hear you when you say like we almost have to like almost like deteach ourselves like certain things, because like as I
Yeah.
like have gotten older, I've learned like if I have some stomach pain, if it lasts a certain amount of days, yes, go to the hospital. Like Pepto Bismol cannot cure everything. Like
Right.
so, I hear you on
Yeah. Yeah. After 7 days, you need to see the doctor.
that.
And I ain't talking about the pastor either.
Oh, that's such a good point.
Hey, Lewis.
I wanted to take this, Louis Magana into the conversation. I'm so glad that you could join us, Louis. Let me introduce you real quick, Louis. Louis Magana works at Southwest Community Health
Hello.
Center, and Majesty is a prep navigator there in Southwest at the center as an outreach worker and has been there for 4 years, where I met her. Originally from California, but now in York, his favorite season is the fall because he doesn't like the winter too much. So I'm glad we know that. Louis, thank you for being with us today. I appreciate you. And so
I
I'm going to
like this
ask you from the
introduction. I'm
offset
gonna
what I
bring you
asked from the
around
offset
everywhere I
earlier, which
go.
is, do you believe the face? Oh yeah, good.
What happened? What was the question? I'm sorry. You're like cutting off on and off, just letting you know. But
You should, because I practiced in front of the mirror last night for a few minutes. So it's a time where we do calisthenics. So everyone do jumping jacks. So I'm just kidding.
oh,
But what I wanted to get I wanted to ask you the basic question of, do you believe that the face of HIV/AIDS is Black or brown? And also curious to know why or why not.
you're asking. Okay, what happened to Max?
I'm sure
Is
he'll
he
come back
gone?
in.
Have we lost him?
He's probably fixing his mic. But go ahead and
Probably,
continue.
because he was cutting on and off. But anyways, the question was, let me see if I got this right, that if the face of HIV was Black and brown people, and if I agree with this, correct?
Why
Um,
or why not? Yes.
I mean, I do agree, but I think we should We do. I think we focus HIV a lot around race, but we don't talk a lot about class at the same time. And like we always talk about these conversations, like, oh yes, Black and Latinos don't go to the doctor because it's part of their culture. Well, yeah, it's not part of our culture because we're broke. I mean, we don't go because we don't want to, but it's expensive to go to the doctor, and if you don't have
Yeah.
insurance or you're underinsured, you're not going to go to the doctor. If your deductible is $4,000, $7,000,
True.
$10,000 if you're in a family plan, you're not going to go to the doctor. So that's why I think, yes, we should always never forget to talk about race because it's very important, because we are not all created equal. We live in the US of A.
Right.
And also of class because, it's also poor white people don't go to the doctor either because
That
of
is true.
the expenses behind it and because they're
True.
also uninsured and they're also like the people that always at risk of getting infections, not just HIV but also STDs because they don't get checked. They don't buy condoms because for some of us it's not a burden, but any extra burden you put onto people that are already struggling, it can be a stretch. So that's why again we should talk about war. We should talk about class and race. What happened
Yeah.
to Max? I wonder.
I'm sure he'll be back on. Yeah, I agree
And
with you too.
yeah,
Yeah,
there's a
with the
book. I
plan.
think who wrote this? This was this book about class and race. Oh, I forgot, but it's very interesting. But anyways, if we look at um, any disease, it doesn't have to be HIV. It can be like we're seeing this through COVID right now. Most of the people getting infected are Black and brown people for the same reason. They're afraid to go to the doctor, and they're also what we now call essential workers. It's they're getting overworked. You see more people. You're exposed to more people, so of course you're at a higher risk of getting infected. But also, most of these essential workers don't have insurance. Either their job does not give them more than 30 hours, which is the requirement to get insurance under the Affordable Care Act. They give them less, so they're not going to be covered and they're going to be scared to go to the doctor because you'll get a big bill. And we've seen this so many times, even this year alone with COVID, where people go to the doctor and they get a huge bill, and that deters people from going to the doctor. So yes, I like to when people say, "Oh, it's cultural." Yeah, it's cultural because there's we're poor. Help us, Medicare for
But
all.
I definitely agree with you when you said it's class as well, because
Mm.
it that does come into play. But you also got, I'm still going to play little devil's
Devil's
advocate,
advocate. No, go
because
ahead.
it's also the ones that are poor are the ones that have to have the $300 tennis shoes, you know what I mean, and the Gucci bags you can't even afford,
That is
and the
true.
BMW that you can't even make the car payments on too. So it
I don't
also
have none of
becomes
that.
along with all that, along with our priorities. You know what I mean?
No, I know, but I mean, if you come to Bridgeport, not everybody's driving a Beamer. Not everybody's driving has Gucci and everything. And yeah, like
Yeah.
I'm sure there's people, because I've seen people that do have Gucci and stuff. Something I would never wear because you're just carrying an advertisement you know,
Someone
for
else.
everybody else. That's what it is. Because the quality, I guess it's okay. I mean, who cares? But the thing is, at the end of the day, most people in America, it's not just here in Connecticut, it's all over the place. We have
Yeah.
a broken health system where it's
That is
only
true.
accessible to those who can pay for it. If you cannot pay a $10,000 um, deductible, you're definitely not going to, it's going to be very hard to take $10,000 out of your own pocket for your insurance to start covering you the way it was supposed to from the beginning. But we have a system where it's only about profit, profit, profit. It's not about having people get covered and everything. So
That's
those
so
are my
true.
2 cents.
It is true. I really want
Thank
to touch
you.
upon like it really comes down to like your geographic location. Like
Yeah.
what you guys were
Yep.
saying. Like for example, Bridgeport, New Haven, Hartford. Those particular three areas are highly like the HIV AIDS rate is higher. in those particular like geographic areas. So it's almost like, like, is it just because like, and this goes into like social economic status, like, okay, like let's just say you are a Black and brown individual living in like a more low income area, you go on one of like these dating apps such as like Grinder and things like that, like you have more access to people versus someone that lives in like the suburbs where like the next house might not be blocks away. So definitely something to consider.
Yes.
Yeah, that's
And also,
definitely. Oh, go
go ahead.
ahead. You go ahead.
I would say, and also, Black and brown people tend to date within their race and within their zip code too, because we're not going to go too far if we can't afford to be
That is
dating
true.
somebody outside of town. You know what I mean? So if I can't get to you within 5 minutes, then I'll just talk to you on the phone every now and then. You know?
I say
That
the
is
same thing.
true.
But look at me. I live in Connecticut because of someone I moved.
Right?
But
Love it.
yeah, I could be in California, but I'm here in the cold. But,
Right. See,
yeah.
that's how it
So
is.
I forgot what I was gonna say.
I'm sorry.
You distracted me. But
So
anyways,
sorry.
next question, please.
I did see a question pop up on the screen talking about the experiments on Black and brown individuals in the medical
Oh, the
field.
Tuskegee experiment and all that. Yep.
Hmm.
Yeah, but you know, I was in Alabama and I actually even spoke to a group of people at the school, Tuskegee School, when I was living there. I was actually the only Black male that was going around openly HIV positive and was willing to talk about it. So I was hitting all of the colleges in the area, and but you know that story is played out. You
Okay.
know, it's played out. You know, it's enough with that. You know, we need to hold these churches accountable. Whoever is got the Black and brown's eye and their hit in their ear, that's who we need to talk to. Celebrities and radio stations. All these people need to begin to talk more about testing and make it more like an everyday thing, so that and that conversation becomes a norm that even our younger generations will be able to just get a test no problem and we keep on stepping and it not be a big issue. I think that's what we need to focus on and stop giving excuses for people to continue to stay where they are.
Thank you so much. I went on vacation, so I just got back. So I'm glad I could be back with y'all. We were having technical difficulties with my phone, so I'm back with you. But I did catch this. There's a fascinating conversation going on with y'all right now. There's two particular things that I noticed, and I really feel like we should unpackage a little bit in the time that we have. But one of the conversations I'm noticing is the kind of the individual versus the culture, right? Because we are kind of like a youth that want things now. I want it now. How is it that in 2020 we're not talking about a cure? I think that's important to
Right.
think about. We're not talking about a cure. We're talking about maintenance, right?
Right.
And that's for many people a functional cure. So that's one piece that's going on, which I think is fascinating, and we should look into it because I want to know more about what Lewis has to say here because he's got really important points. And Keith, you're coming from a place that I feel like needs to be talked about more because I'm telling you, Black and brown communities have this where you know what, where we listen to people of authority who are pastors, who are reverends, who are priests, and they may be tapping into feelings of distrust of public health field, right? So I feel like you're absolutely right when you make a point that you say we need to get them to be educated so they can educate their flock. If they care about their flock's health, then what's good? So there's that piece, which I think is really important and needs to be hit on. But the other one, which I think is just as equally also, is that there are folks who are asking, and Charles, thank you so much for picking that up, that there are folks who are asking about those suspicions, right? And so I feel like there needs to be a space to be able to heal those suspicions. Not so much say, hey, you know, y'all got to get over it. It's more kind of like, this did happen. You know, people were hurt. And incentives that existed then, you know, frankly, the profit-driven incentives that existed then still exist today, right? If we're talking about COVID vaccines, if we're talking about how, you know, right now, what I can tell you is that African Americans are up to 13% of the population, but they represent 25% of COVID deaths.
Right.
And the death rate of COVID-19 for African Americans is over twice for white people. Earlier this year in August, it was 45%. The whole country, 45% of those that died were African Americans. And that is more than any other in the world. African Americans in this country got killed more than any other in the world in August. So if we think about these numbers, then we got to consider individual and culture. But I digress, because I think those are 2 points that need to be going into. But let me ask you this. Decriminalization of black and brown bodies is something that happens almost at every level in every way. When it comes to HIV, it's no different. There are 26 states that have laws criminalizing HIV. We're in Connecticut, so that's not so much a problem here, but it is a problem in the country as a whole, right? So what I'm asking you is, how is it that when the face of HIV/AIDS is black or brown, it's easier to criminalize? So I want to get to solutions, because beating up on white supremacy is something that I made a hobby of my life. It's probably going to be my life's work. But more importantly, how do we get to solutions, you know? And so I'm going to ask you, what kind of solutions are the ones, because y'all already talked about this when it comes to, you know, reaching out to the pastors and such. But when it comes to Medicare for all, when it comes to rapid testing, when it comes to these solutions, what are the solutions that we're not envisioning that y'all see rubber hitting the road every day? I'll stop talking now. Louis, go first.
I think we already know the solutions. It's just very difficult to get them done. For example, this all needs to come down from the government. So we need to talk to our elected officials, because let's be honest, they're all in bed with the pharmaceuticals. They're in bed with everybody. So that's why these medications are expensive here in the United States. It's not a mystery that PrEP is, $1,600 a month without insurance in the United States. But if you go to England, exact same medication, exact company, same everything, it's $30. So it's no mystery. It's, they make the laws for themselves. They're gonna profit as much as they can from all of this. And just like COVID, the vaccine is like how much? It's like a couple thousands. And who's going to be the people that are going to be able to afford this? It's not going to be black and brown people. It's not going to be uninsured people. It's not going to be, our people. It's going to be people who are insured, or people, white people. That's why most of our people are dying. It's no mystery. And the same thing, you can look at any other disease. It's the same, like people affected. It's brown and black people because they're the poorest and they're the most uninsured. For example, when AZT came out, which was one of the first medications for HIV back in, I want to say, the 80s, which didn't really help a lot. It was actually causing a lot more problems for people, a lot of side effects and everything. AZT was between $8,000 and $10,000 back then, which was a lot of money. That is like $20,000 now or more. So this exact same pharmaceutical received money from the government for research and everything. So the taxpayers invested the money, but they got no investment back. And we see this all the time with pharmaceuticals. For example, with PrEP, it was funded by I hope Gilead is not watching this. so it was funded by taxpayers, and we got nothing in return. We get your insurance is going to deny you if they want to, like United. And if you don't have insurance, come talk to me because I can get it to you for free. But if you don't have insurance, you have other problems of getting it covered. So it's the same thing going on and on. There is nothing new here. It's profiteering and it's a crime against humanity.
Yeah. I think that especially when it comes to no cure for AIDS at this moment, like really, how long, and even with cancer, there's so many conspiracy theories thinking that they got the cure already, and they could, but because we don't know the truth about all of that for our personal selves, to really say yes, yay or nay, there's still something we have to do as a human is in the meantime. And that's what we need to get people to get to. In the meantime, what are you doing? In the meantime, are you at least checking in, or at least seeing the doctor once a year? If you can't make it every twice a year, what once a year? You know, um, even I think churches have a chance to come back after all this drama with the president and all that stuff like that. They can come back now by opening up health centers in their churches. That once this pandemic is lifted, that we can actually go back out in society. They should have more health fairs where we can test your blood pressure, um, have it all encompassed all within one. And getting an HIV test was included with all of that without even making a big issue about a test. You know what I mean? I think things like that should happen within, and not just the churches. If I go to the club, well, then the club has responsibility to help as well. If I'm going to a social gathering, a book club, or any of that, whoever's out there doing something for the community, they have responsibility to give us all of the information, not just some.
Latrell, did you want to add anything about solutions?
No, like Lewis was saying, you really just have to start talking to elected officials, lobby. I think like for the many years now, Black and Brown people felt like they did not have a voice, and I think that some people are still have that mindset. So feel like, okay, well, like my voice isn't going to be heard, and that's not true. So lobby, because things definitely need to be changed. For example, one of the HIV medications now, Biktarvy, that medication retail price is $3,000. So things have changed a little, but things definitely still need to continue to change, because realistically, that is just extremely
crazy.
too much to pay for. Like,
well, PrEP should be free.
It should. And it's starting January 31st. All insurances need to cover it without co-pays, Descovy and Truvada. If you don't, file a complaint, get them in trouble.
So you're saying after a certain time, PrEP should be covered by all insurance policies? Is
Yeah, it was approved by the I forgot. But the thing is that I don't know these acronyms. So pretty much the American Medicine, I forgot the name. But anyways, they obviously agreed that PrEP is very effective against fighting, preventing HIV. So they finally realized that people, should be taking this and not be charged for taking precautions for their health. So this is like the only good thing that the Trump administration did right, where it's that I'm serious. So they made this deal where insurances have to cover Descovy and Truvada, period. Like they're not supposed to give you any co-pays or for any of the medicines. I don't know what's gonna happen because Gilead has a copay assistance program, which is actually kind of good because it counts towards your deductible. FYI, if you didn't know that. But I don't know. I kind of like this little hack that I'm doing, but don't tell Gilead. She's actually supposed to come right now, but
it'll be interesting to see how the Biden administration makes those moves too. There's a history of Republican administrations actually sticking their neck out for folks who are HIV positive. I do want to mention that, whether it's
it didn't happen under Reagan though.
That's right.
Actually, yesterday was World AIDS Day. Yesterday was World AIDS Day, which, since 1988, we remember all the people who passed away because of HIV, which was, I believe it was 900,000 that have passed away, which is a lot. And when the epidemic was first found out here in the United States, the government did absolutely nothing, just like they're doing with COVID. And this is kind of sad to say, but if you go on YouTube, you look up the videos of the Reagan administration, their press secretary, the press secretary was making gay jokes while the whole AIDS crisis was going on. While people were dying every single day, they were making gay jokes in the White House. And Reagan didn't speak about the AIDS crisis up until 1985. And he knew about this since 1981. He did not mention it at all, at all. And he was not funding any research, nothing. So we lost a whole generation of people because of the inaction of these people that
Yeah.
they quote unquote don't believe the government is the solution, but then they profit from the government. So this is these crazy people like Trump that are useless and just make a piggy bank out of the White House. And that's just the facts, okay?
And that adds to your point how not much changed. When
And it hasn't changed. And it's not because these people are dumb. They are not dumb at all. They are very, very intelligent. However, they are there for the business of making money. They are not there to help you. And if they help you, they're gonna be losing money. And that's the end of the stick. We have a lot of money because they just printed 4 trillion out of thin air, and they didn't even say, where are we gonna get the money?
Right.
No, and then that's a wonderful point there, because I think that just, if they really did, you're right. You're so right when you say that they're smart, because if they really cared about,
They're not dumb, no. I don't think Trump's an idiot. I think Trump knows exactly what he's doing. He knew exactly what he was doing from the beginning.
Yeah, and these folks, and it's not just him, public health officials that have been at this for years have looked at the number, and they know, if you wanted to understand how to end an epidemic, if you wanted to understand how to end a pandemic or prevent it from getting to that length, go to the Black and brown communities. When the U.S. population shivers, Black and brown people die. They get sick and die. That the numbers bore that out. I don't even have to make that. I don't have to make that up. The numbers bore that out. So if they wanted to do something about this, there's ways to get it done, right? So we just have to apply pressure. And that's what happened with ACT UP. That's what happened with the Denver principles. That's what happened with these different scenarios where people living with AIDS stood up and advocated for themselves.
Yeah.
Keith, they used their free will, their God-given free will, to stand up and advocate for themselves. And that's something that I think that we need to be more, like I said earlier, invited into these struggles, so we feel like we're part of them too. We're coming up in an hour, and I want to respect folks' time, except Lewis's. But I mostly just wanted to get to the point that, I want to appreciate y'all being here, because just like the last conversation that Lewis and Keith and I were part of over at Quest with Juan, it feels like these are things that we need to be talking about. It's healing. Yeah. It helps us feel like we're part of it, right? So, so my question would be, if we would have another conversation, what are the topics that you think connected to this that you'd like to see more folks talk about into the future, into the next year, into the next rollout of whatever's happening now? Let us know.
Well, I think that we should include all the other STDs that people are living with. Includes HPV, herpes, and all of those things that other people have that we don't talk about, because they would feel like they're being left out or they're not as important. But people still need to know that those drugs or those STDs are still out there, and people still have struggles trying to tell and talk about those STDs as well. And we need to talk more about loving ourselves with our bodies, and it being okay to talk about sex and it not be such a taboo.
That is correct.
Yeah. There's 5 panels you just gave me right there, by the way.
I'm for it. I'm on it.
I appreciate you. Lewis or Latrell, sorry.
I think, I don't know, maybe you should ask the people what they want to, hear us talk about, because I think we work in this field, and we kind of, bounce back between the same topics a lot. And, maybe people have other ideas, because we might not talk about something because we don't, we might not think about it at all. And some people want to know other things. So I think it'd be great to ask them, hey, what do you want to hear? Or what don't you want to hear? But I'll talk about it anyways. And, just ask them what they want, because, I don't know, we could talk about the housewives. No, let's not talk about the housewives.
Oh, no. That's 6 more panels you just gave me now. All right. Latrell, if you wanted to add anything. Did we lose Latrell?
Oh,
Oh,
lost the online.
there he is.
There you are. I was just curious to know if you had any topics you wanted to add, or any closing statements you wanted to make.
No, the only topic that I would add is really just like toning in on HIV with injection drug use, because I feel like sometimes that's like often like forgotten about, and people always like assume that like HIV is only transmitted through sex, and that's just not the
Right.
case.
Yeah. And that also includes our transgender population as well. You know,
Mhm.
not just the drug people that inject drugs, but I'm also talking about the ones that share needles for their hormones and things like that. There needs to be education along with that as well.
Wow. Yes. That is a lot right there. I appreciate that. I wasn't gonna give my suggestion because as a panelist, I think I talked more than I needed to. But I was gonna suggest talking about addiction, substance use disorder.
Yeah.
Generally, I feel like this
Mhm.
year in particular, there are a lot of folks who are dealing with things that they haven't dealt with in decades, maybe.
Yes.
We're dealing with
Yeah.
unprecedented stuff. So
Yeah.
talking about the connection between SUD and HIV or STIs in general, I think that's an interesting place to go down. But that's, I feel like that's further down the line. But I want to appreciate all of you for bringing your lived experience, for bringing your smiles. And clearly we hit on something that I think that we're going to be talking about more into the future. I know I'd like to.
Yes.
I want to thank you again for being part of the World AIDS Day roster that we got going on. Please visit our website to see more. We have more going on. Today's the second to last day, so we have more for you going on tomorrow and later today at 3:00. We're going to be having a panel specifically focused on health disparities for certain communities, and we have folks like AC Demidon. We have professionals in the field who are going to be part of this conversation too. So I really look forward to that one. Tune in at three if you want to be a part of it. And thank you so much, Latrell, Keith, and Lewis for being a part of this. I know I'll be hounding you into the
Thank you.
future about being part of future ones too. Thank you so much. And as always, te vemos pronto.